Everyone, in this part I would be discussing the answers for paper 2 from question number 1 to question number 40. So let's start without any further delay. In the question 1 they are saying which of the following are included in grade 2 acute cholecystitis as per the Tokyo consensus guidelines. So here we have grade 2 acute cholecystitis guidelines. Here we have elevated WBC, then palpable tender mass, duration of complaint should be more than 72 and there should be marked local inflammation. In the options provided to us we have this question is right, there is no renal dysfunction, duration is right, marked local inflammation. So the answer for this is 1, 3 and 4. The next question they are saying is the maximum tensile strength that a wound can reach when the healing is complete. So it is up to 80%. So the answer for this is 60 to 80%. In the third question, the most common site for development of pressure sore. So these are the pressure sites arranged in the form of descending order. So ischium is at the top. So the most common site is ischium. After that we have greater trochanter. Then in the fourth question, which of the following are included in triple assessment in case of breast? So we have clinical, radiological, histopathological. Clinical, radiological and or cytological. There is no sentinel lymph node biopsy. So the answer for this is 1, 2 and 3. In question number 5, which of the following are the extraintestinal manifestation of Crohn's disease related to disease activity? So these are the extraintestinal manifestations. On the options we have pyoderma, sclerosing and amyloidosis. There is no arthropathy in this. So the answer for this is 1, 2 and 3. Correct regarding gastrointestinal stomal tumor GIST. So it is the rare tumor. It is the most common non-epithelial tumor of GIT tract. Stomach is the most common site and it is equal in both sexes, and GIST almost metastasized to regional lymph nodes. So it arises, the options are, in the options we have to find which statement is correct. It arises from epithelial layer, then it's wrong. It arises from non-epithelial layer. The male to female ratio is this? No, it is equal. 50% arise from stomach, that lymphatic spread is seen commonly, then it's wrong. It is actually what spread? It never metastasizes. In the next question we have which of the following is used in the treatment of eclasia. In the treatment of eclasia cardia we use Hellas cardiomyotomy, pneumotic dilation and botulinum toxin. So here we have these in the options. There is no use of beta blockers in this. So the answer for this is 1, 3 and 4. In the 8th question, which of the following are intraoperative features of viable small bowel? So these are the viability of bowel. We check peristalsis, pulsation, bleeding in mesentery and bowel wall, friability and color and serosal shining. So here in the options we have visible peristalsis, that's right. Flabby, true. Shiny, true. Visible pulsation in the mesenteric artery, no. In the mesenteric artery there is bleeding. We won't find pulsation there. So the answer for this is 1, 2 and 3. In the 9th question they are saying regarding peptic ulcer which of the following statements are true. So duodenal ulcer more common as compared to gastric ulcer, that's true. Most peptic ulcer are caused by H. pylori or NSAID, that is also true. And the third thing is complications of duodenal ulcer, then bleeding is the most common. Then all the 3 statements are true in this case. Which of the following statements are correct with regard to Budd-Chiari syndrome? In the Budd-Chiari syndrome, it affects young females. Venous drainage of the liver is occluded by hepatic venous thrombosis. Abdominal discomfort and ascites are the main presenting feature, and antithrombin C, protein C and protein S deficiency are associated with it. So which of, let's see statements. Venous drainage, that is true. Is most commonly affect young males? No, it is females. It is associated with protein C, protein S, that's true. And this is clinical features are true. So the answer for this is 1, 3 and 4. The next question is during the first stage of labor the intrauterine pressure is increased up to. Then it is the intrauterine pressure 2 to 3 mm Hg is during pregnancy when the uterus is inactive, while during the first stage of labor it varies from 8 to 10 mm Hg. So the answer for this is 8 to 10 mm Hg. Next question they are saying is which of the following are screening tests for cervical cancer? So these are the screening tests. We have then HPV DNA testing, then visual inspection with acetic acid. So 1, 2 and 3 are wrong. Endocervical curettage, it is not done for the screening purpose. So the answer for this is 1, 2 and 3. Heavy menstrual bleeding is a common presentation in which of the followings? So these are the causes. In this we have fibroid, adenomyosis and ITP platelet deficiency. So we have clotting factor deficiency, fibroid, adenomyosis. Prolactinoma, we don't have heavy menstrual bleeding. Serum level of Ca-125 is raised in which of the following conditions? Then serum Ca-125, it is raised in the case of endometriosis, epithelial ovarian cancer. So the answer for this is epithelial endometriosis. It is not raised in pelvic inflammatory disease. In next question, uterus is supported by which of the following ligaments? Then the key point is here they have mentioned ovarian ligament, but it's actually round ligament that support the uterus. Other than that, broad ligament and cardinal, uterosacral, rectovaginal and pubocervical. Here are the levator ani, main. 3 are right, 4th is wrong. In next question we have which of the amongst the following the Pearl index is highest weight. Now I am sharing you the table with you all. Now it's your homework to write down in the comment section what should be the correct answer for this. These are the Pearl index for the various methods. So you have to find out the correct answer for this question and drop down your answer in the comment section. Following vaginal delivery, uterus becomes non-pregnant size by, then at the end of 6 weeks it becomes non-pregnant state. Then answer for this is 6 week. Indication and prerequisite for delivery with the ventouse include which of the following? Then delay in the second stage of labor, non-assuring fetal heart rate and vertex presentation. These are all the indications and prerequisite. While gestation is less than 34 weeks is not an indication for ventouse. Which of the following fetal infection are associated with significant intrauterine growth restriction? Then we have torch, and in torch we all know that it is toxoplasmosis. Others then R for rubella, C for CMV and H for herpes simplex. So the HPV is wrong. So the answer for this is 1, 2 and 3. Missed abortion is not diagnosed if, then these are the features which we get during the missed abortion is persistence of brownish vaginal discharge. Then the second thing is cessation of uterine growth, which in fact becomes smaller in size, non-audibility of fetal heart sound. So vaginal bleed, uterus smaller, external loss is closed, USG show fetus with cardiac activity, that is wrong. Uteroplasty is the surgical procedure done for which uterine anomalies like biconduit and septate uterus. So the answer for this is septate uterus. In question number 22, which of the following are the clinical features of hyperprolactinemia? Then in the hyperprolactinemia, we have why it is occurring? Because of the inhibition of gonadotropin secretions. So women suffer from oligomenorrhea or amenorrhea. In this case, what they are saying oligo, then that is true, heavy is wrong, and it is gonadotropin deficiency and it is hypogonadotropic, hypogonadism. So the answer for this is 2 and 3. Which of the following are effective in management of premenstrual syndrome? Then these are the therapies beneficial in premenstrual syndrome: diuretics, OCPs, then oophorectomy, and the fourth one is pyridoxine 100 mg. So we have niacin, vitamin B3, that is wrong. Instead of that, pyridoxine should be written. Then combined OCPs, diuretics and hysterectomy, that is true. So the answer for this is 2, 3 and 4. In question number 24, which of the following blood test is the marker for ovarian reserve? Then for the ovarian reserve, anti-Mullerian hormone is the marker. So the answer for this is AMH. In the Palm-Cohen classification by FIGO for abnormal uterine bleeding, ovulatory dysfunction is the cause in which of the following condition? It is for the polycystic ovarian syndrome, hypothyroid, hyperprolactinemia, obesity. So we have among these only polycystic in the option, then answer this is polycystic ovarian disease. In the question 26, which of the following are correct regarding genital wart, that is condyloma acuminata? Genital wart condyloma acuminata, it is caused by the HPV, usually type 611, usually multiple, can be transmitted sexually, and vagina and anus, it has a 10 and 20% distribution. Now what's the statement? It is usually single, that's wrong. It is multiple. HPV 611, that's true. Can be transmitted sexually, true. It can involve vagina and anus, that is true. So the answer for this is 2, 3 and 4. In 27, which of the following are correct regarding endometrial cancer? Then in endometrial cancer usually occurs in the white population. Then persistent stimulation of endometrium with unopposed estrogen is the single most important factor for the development. So we have persistent progesterone stimulation, and that is wrong. It is actually estrogen stimulation. White population, then HNPC is the high risk factor in adenocancer histopathology, that is true. Main you have to catch the word progesterone, it is actually estrogen. The reference point 0 in the POPQ classification is taken as, it is actually taken as the plane of the hymen. So the answer for this is hymen. In question 29, they are saying which of the following are the various treatment options available for the Twin-Twin Transfusion Syndrome. Then first is laser photocoagulation, second is selective reduction feticide, third repeated amniocentesis, and fourth is the septostomy. So the answer for this, all three are true. Next is which of the following drugs should be avoided in laboring women with bronchial asthma. Then in bronchial asthma what we can use is oxytocin, prostaglandins A1 or A2, and while the prostaglandin F2 alpha it is contraindicated. So prostaglandin F2 alpha is contraindicated and opioid analgesic is contraindicated, ergometrid. They are asking what can be, which of the following drugs should be avoided in laboring women with bronchial asthma? Only E1 can be used. So 1, 2 and 4 should be avoided. Then mycetoma, they have asking statements about the mycetoma. Then mycetoma, what we can have, it is actually a chronic specific granulomatous disease. It involves the skin, subcutaneous tissue and the deeper structure. Causative agent of fungi, then it is known as Mycetoma. It is caused by bacteria. Then actinomycetoma. What are the statements? We have to find out the true statement in this. So it is bloodborne infection, that's wrong. Involves the superficial, no. Involves the deeper. So the answer for this is it may be caused by fungi or bacteria. Next question we have is which of the following statements are correct regarding the Buerger disease? Then in Buerger disease, known as thrombin angiitis obliterans, it is the disease of small and medium sized arteries. It occurs in the male smokers. Treatment is totally abstinence from smoking, which arrests but does not reverse the disease. That's the keyword here. So what's the statements? It involves small to medium, true. In smokers, yes. Lower limb, yes. Cessation of smoking, reverse the disease process, no. It actually only arrests, it does not reverse. So the answer is 1, 2 and 3 are true, 4th is wrong. The next question is the most difficult area to visualize using duplex scanning. Then we have during duplex scanning, the aortoiliac segment can be difficult to visualize. So the answer for this is aortoiliac segment. In the next question we have is which of the following vital structure in the axilla should always be preserved in MRM? The axillary vein and nerves serratus anterior and latissimus dorsi should be preserved, while intercostobrachial nerve are usually splitted in this operation. So vein, serratus anterior, latissimus dorsi we have to preserve, while intercostobrachial we used to split it. So the answer is 1, 2 and 3 are true. The most common metabolic abnormality associated with gastric outlet obstruction, then we have hypochloremic alkalosis. Then the answer for this is hypochloremic alkalosis. Next question, the gold standard for the diagnosis of gastroesophageal reflux disease. Then 24-hour pH recording is the gold standard for the diagnosis of gastroesophageal reflux disease. Next question we have which of the following factor predispose to the development of incisional hernia? Then these are the factors that leads obesity, poor healing due to malnourishment, immunocompromise, chronic cough cancer, wound factors like wound infections, surgical factors, inappropriate suture material or incorrect suture placement. So we have malnutrition, that's true, wound infection true, immunocompromise true. Now here they are saying non-absorbable suture material. It is actually inappropriate suture material, like the what suture should be used there, we have not used that. That's not particularly non-absorbable suture material, so this statement is wrong. So the answer for this is 1, 2 and 4. In question 38, which of the following statement regarding papillary thyroid cancers are correct? Then regarding papillary thyroid cancer, we have it is the most common thyroid malignancy and it is known for its lymph node metastasis. So they are saying it is the most common, true, in young females too. It is a propensity for hematogenous spread, then that's wrong. It is actually lymph node metastasis. So the answer for this is 1, 2 and 4. In question 39, which of the following statement about peptic ulcer are correct? Then we have common sites for the peptic ulcers. Peptic ulcers are the first part of the duodenum and the lesser curvature of stomach. Next we have anterior place ulcers tend to perforate while the posterior duodenal ulcers tends to bleed, and the sex incidence is equal. So the most common location is the third part. No, it is actually first part. Most commonly seen in females. No, it is actually equal in both male and female. There is no risk of malignancy in gastric ulcer. False. There is. Anterior located are more prone for perforation. That's true, while the posterior one are more prone for bleeding. Chronic duodenal ulcers are not associated with malignancy, and in contrast gastric ulcers are. So they are saying no risk of malignancy in gastric. No, there is risk of malignancy in gastric but not in duodenal. So fourth statement is right and the first three are wrong. In question 40, they are saying which of the following statement regarding annular pancreas are correct. Then about the annular pancreas, these statements we have is it is due to failure of complete rotation of ventral wall of pancreas, so that ring of pancreatic tissue encircle the second part of duodenum. So the ideal treatment for that is duodenectomy, and clinical feature we have bilious vomiting. So let's see the statements. It results from failure rotation of dorsal pancreatic, but no, it is actually from because of ventral. A ring of pancreatic tissue surround the second third part of duodenum. That's true. It present with vomiting. That's true. And duodenectomy is the preferred treatment. That's true. So the answer is 2, 3 and 4 for this. So these are the first 40 questions from the paper 2. You all must have noticed that when we have this type of questions in which we have to choose these statements, then we have to look at the point where a single word can play the role, like dorsal can be ventral, so this must be wrong. Third can be first. Then in the hematogenous can be lymph node, right? And in the other one we have this type of similar, like progesterone can be estrogen. So if you are confused, single can be multiple. If you are confused between the options, then try to look any word is there in the question which can be manipulated, so it become easy for you to guess the answer. So all the best. Let's meet you in the